Welcome back, everyone. Thank you guys for your patience. So this is where we stopped. So far we managed to cover like 5 or 4 topics. So we'll keep going. I'll try to be again fast so that we don't waste too much time. So the next topic is loss of vision. And loss of vision is a very important topic. So there's sudden loss of vision that happens suddenly, and then feel gradual loss of vision. Sudden loss of vision, we'll start with that. And it's mainly the topic that most people talk about on its own because it has its own causes. Gradual loss of vision, usually causes حقتها is similar to the other causes اللي هما we already, like some of the ones we already talked about and some of the ones we're going to talk about later. Okay? Is my voice clear and everything all good?
Yes.
Yes.
Perfect. Thank you, guys. Okay. So the sudden loss of vision, if any form of opacity that happens in any...
Video was open, but my laptop has a privacy thing that was on.
Sorry? Okay,
Sorry, I unmuted. My bad.
it's okay. So an eye has some specific things that are supposed to be clear, parts that are supposed to be clear. And if any part of these clear things, something wrong happens there, that is also one of the causes of loss of vision. Some of the things we've already mentioned, اللي هم keratitis والcorneal ulcers, anterior uveitis أو posterior uveitis. Endophthalmitis is basically just inflammation of all of the parts of the eye. الحياة دي. If there's any form of inflammation to any specific part of the eye that's supposed to be clear, it's going to be causing loss of vision. في angle closure glaucoma, we're going to talk about it later. The other causes عندنا vitreous hemorrhage, which is basically hemorrhage in the vitreous part or the vitreous humor. It is usually painless, and usually it happens as a result to another cause of disorder. So it doesn't happen on its own. It's either due to long-standing diabetic retinopathy or a central vein occlusion, or macular degeneration, or a detachment or something like that. So it always comes after something else happens. تمام? And what it looks like is like that. So when you look into the eye with the ophthalmoscope, you'll literally see hemorrhage inside the eye. تمام? Be one of the causes. And it just, the second the hemorrhage starts, that's when the person loses their vision. So it's sudden loss of vision. في تاني, retinal abnormalities. So anything that affects the retina will result in loss of vision because the retina is the part that's recepting or receiving the vision signals, صح? So عندنا retinal vascular disease. retinal vascular disease ممكن تكون issue بالartery, ممكن تكون issue بالvein. الartery بيحصل sudden painless loss of vision in the whole visual field. تمام? So everything gets black. لو حصل branch occlusion هيحصل black or like loss of vision in only parts. تمام؟ اللي بيحصل here is like it's an emboli أو atherosclerosis أو valvular disease. So it's similar to the idea of getting a heart attack, for example. بيحصل blockage in the retinal artery. تمام؟ اللي بنشوفه شنو؟ بنشوف pale retina. دي مهمة جديدة عندنا هنا. إنه you will see a pale retina. لأن عنده blood supply يتفقد من الريتنا. هنشوف لنا cherry spot, so there's going to be like this one specific part that's red, more red than the rest. And هيكون في thread-like arteries. لكن I want you to focus on the pale retina part because that's how I usually remember it. Treatment, digital massage, acetazolamide, anticoagulants. So it's pretty much you're going to be treating it similarly to the idea of لو جات الزول any form of occlusion of any other artery. تمام؟ In the retinal, central retinal vein occlusion, similar idea. There's going to be painless loss of vision. لكن هنا الفرق is that the vein is closed, so there's going to be like congestion. تمام؟ Our risk factors are hypertension, diabetes, raised intraocular pressure. هنشوف شنو dilated veins. هنشوف flame-shaped hemorrhages and cotton wool spots. وmacular edema. So الفرق وين؟ الفرق إنه في artery occlusion بيكون our issue is that there's no blood supply, so it looks pale. Sorry, it looks pale. لكن في central retinal vein occlusion البيكفي اللي هو الvein بيكون ما في blood drainage, so هتكون الحاجة it looks red, it looks swollen, it looks like there's a lot of hemorrhage there. And I'll show you guys pictures today to look at the difference. These are the difference between the two. This is a central retinal artery occlusion. It's all pale except for one red spot. this central vein, everything is red, everything looks like it's on fire. Okay? It's very clear difference between a retinal artery or retinal vein on a picture because they both present the same way. You have to be able to look at the picture to tell the difference. Okay? So artery هتكون very pale. Vein هتكون very congested and looks like it has flames on it. In a retinal detachment, دي تحفظوها because the way it presents is super important and they don't usually give you extra information أساسا. إنه it's painless برضو لكن it's preceded by floaters or flashing lights and it's curtain-like loss of vision. يعني بقول لك إنه الزول قبل ما تجيه طوالي كان في light flashing أو في شافوا لهم حاجات floating on the air and then immediately afterwards it's like our vision went down like a curtain. They use that word specifically. شفتوا زي it's a specific word that's always used when referring to retinal detachment. إنه curtain-like loss of vision أو vision preceded by floaters or flashing light. دي you have to memorize it. Okay? دي معناتها الريتنا ذات نفسها اتفكت or it got detached. There are a lot of risk factors like old age, high myopia, trauma, retinopathy, family history, and so on. في تاني ال wet age-related macular degeneration. إحنا قلنا الماكيلا is in the center صح؟ والماكيلا هي فيها most amount of cones صح؟ So it's like super important when it comes to color vision and clear vision. دي اللي بيحصل هنا إنه الماكيلا هي اللي بيحصل لها degeneration. Only the macula. Everything else in the eye is fine. So بيحصل central loss of vision. الزول بيكون مكشوف في النص لكن they can see in the peripheries. دي الماcular degeneration أو ال wet age-related macular degeneration. In tiny retinitis pigmentosa, this is an inherited disease, which basically is a degenerative disease. بيحصل loss of vision as you go. And it's because of, I think, replacement of the eye by pigment or something. Like, look at that. Al pigment هنا, it gets black. And because of that, the eye cannot see anymore. So it's gradual. Sudden. It's a gradual loss of vision. And بيبدأ by night blindness and peripheral visual field loss. So as you can see here in this picture, blackness ده بيبدأ وين؟ في الأطراف. It happens in young people, and it's degenerative, so it keeps getting worse as they grow up, and it's inherited. So I don't remember the mode of inheritance, but بيكون في family history, very strong family history. Okay? تاني نراجعهم سريع. Artery بيكون pale. الvein بيكون like there's flames and fires. And retinal detachment, the retina literally falls off. تمام؟ And the retinitis pigmentosa بيكون في black pigment on the eye and it's peripheral. الماكيولا لو شايفين now central part, it's still fine. في حاجة تانية اسمها amaurosis fugax. Amaurosis fugax is temporary loss of vision, transient loss of vision. دي زي transient ischemic attack في البرين. It's similar to that. اللي بيحصل إنه في emboli بتيجي في ال retinal vein أو retinal artery and it goes away afterwards. So it's just they lose complete vision for a minute or two and then it goes away. تمام? Sometimes in some people, migraines can cause loss of vision due to vasospasm and it goes away afterwards. It's also transient. So لو في زول جاو loss of vision وبعد we have two options. Yeah, amaurosis fugax, which means they get emboli دخلت الvessel وبعد ذاك فتحت، أو it's a migraine عمل vasospasm للvessel وبعد ذاك فتحت. تمام؟ في other causes إن الأوبتيك نيرف abnormalities. المشكلة تكون في الأوبتيك نيرف ذات نفسه. إن الأوبتيك نيرف abnormalities إن demyelinating optic neuritis, and this is probably like commonly in multiple sclerosis, you'll know about it. Optic neuritis إنه المyelination حق الeye starts to go away. أو it's demyelination of the eye. It's associated with pain on eye movement. So eye movement بيحصل فيها pain. They're very 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 specific for it. وبعد ذاك بيحصل loss of vision. So في الأول بيكون عندهم مشكلة they cannot move their eye, it hurts when they move it, and then a few days later they lose vision. دي بتيجي مع منو؟ multiple sclerosis specifically. So you need to look for the common features of multiple sclerosis in the question. في non-infectious optic neuritis. It's autoimmune بيجي مع SLE أو sarcoidosis. The other ones like neuroretinitis, which comes with cat scratch disease. في anterior ischemic optic neuropathy تبجي مع giant cell arteritis. And so you just treat the cause. So you treat it with steroids. And obviously feel increased intracranial pressure. Increased intracranial pressure can cause loss of vision. And the feature that you need to look at is papilledema. Okay, so you get papilledema, which is basically the swelling of the optic disc. This is papilledema. You'll see swelling of the optic disc. This is specifically known for increased intracranial pressure. في optic atrophy. Optic atrophy is when the disc is starting to die. So in a disc بيكون it's pale and white, but the margins are distinct. ده في primary. The secondary, which is caused by something else that happened first, بيكون the margins indistinct. And I don't think it's that important to know the way it looks as much as the other topics. في toxic amblyopia, if Nabila is writing your exam, it's gonna be in the exam. Because it's very common in Sudan. It's basically إنه بيحصل toxins في optic nerve, and that's mainly due to cyanide or formic acid. Formic acid is very common with دقيقة sorry يا جماعة. Formic acid is a metabolite حق methyl alcohol. يعني most of the alcohols in Sudan are methyl alcohol, not ethyl alcohol. عشان كده بيعملوا formic acid as a metabolite. والformic acid يمشي للآي بيعمل toxic amblyopia. So that's why it's one of the common causes of blindness in Sudan. Gradual loss of vision أنا ما خدتها في الشيت لأنه it's common with a lot of other diseases. We'll see it soon. Any questions so far? معلش, I know I'm going very fast, لكن it's just because your exam is بعد بكرة there's not enough to, like, there's a lot of topics and I don't want to like stay too long on them. Okay. Ocular manifestations of systemic disease. عندنا diabetic retinopathy. Super important, you guys know this really well. لأنه it's also the third most common cause of blindness in Sudan. So عندنا a lot of common causes حق blindness. عندنا diabetic retinopathy, عندنا toxic amblyopia, عندنا trachoma. These are common causes. تمام. ده يلا because gradual blindness, not sudden. Okay. اللي بيحصل شنو؟ وحاجة تانية important is that it's going to be bilateral because diabetes is a common condition. يعني it affects both eyes. It's not going to affect only one eye. في حاجات that make it worse وفي حاجات that make it a bit better. حاجات that make it worse is the duration of the diabetes. So the longer you've had the diabetes, the more likely it is to cause diabetic retinopathy. Poor control. So the more you're not controlling your diabetes, the more it's going to be there. Age of diagnosis is also significant. Smoking, pregnancy, and if there's any other disease. يعني زول عنده hypertension مع diabetes is worse than the person who doesn't have hypertension مثلا. تمام? They need yearly screening. So anybody with diabetes needs to do yearly screening for their eye to avoid the diabetic retinopathy أو تكون up to date with it. تمام? It has stages. So it has 6 stages. And this has always been a problem. I hated it like zaman, but stage 1 does not show retinopathy. So this person has diabetes, but you cannot see any retinopathy. ده كده بيسموه stage 1 diabetic retinopathy. تمام. Stage 2 اسمه background retinopathy, and that basically means إنه there's still not effect. It did not reach to the point إنه retinopathy ده يكون فيه مشكلة. So stages 1 and 2 vision is normal. Okay. عندنا microaneurysms. So بيكون في small aneurysms بتحصل في vessels. ممكن يكون في flame or dot and blot hemorrhages هوريكم لها هسي. Exudates. Exudates are going to be there, so there's going to be some fluids collected, but they're going to be away from the macula. وقلنا قبل إنه macula is the most important part when it comes to vision. So as long as the macula is spared, your vision is normal. تمام? So the dot and blot hemorrhages, you'll just see dots like that. I hope the color حقها هنا دي مظهرة عادي. شايفينها؟ It's like these dots. These are dot and blot hemorrhages. بس بيكونوا قاعدين around the eye. They're not in the macula, so they're not in the center. And في exudate. الexudate ده الوايتنس ده برضه بيكون away from the center. It does not affect the center of the eye. بيكون exudates بعيدين. ده كده ده stage 2. okay. ده كده okay. تاني عندنا maculopathy which is grade 3. Grade 3. So grade 1 and 2 you do nothing. You just have to control your blood, diabetes, control it and regularly follow up. بس maculopathy بيكون في exudates and hemorrhages within the macula. So اللي حصل المشكلة شنو إنه exudates والhemorrhage وصلت للماكيلا. and الحاجات التانية بتحصل إنه ممكن يكون في retinal edema أو يكون في ischemia. Because of that, the vision is going to be reduced. Okay, so stage 3 where only the macula is affected, that is maculopathy. Only the macula is affected. Because the macula is affected, it's going to cause vision loss. عندنا I hope I can see a picture. في الcotton wool spots دي يكون في white spots زي دي كده all over the place including in the center. all over the place بيكون في cotton wool spots. تمام. تاني عندنا ال pre-proliferative. Pre-proliferative by the way does not affect the retina, the macula sorry. So عشان كده الفيجن بتكون normal. That's something super important إنه الفيجن في diabetic retinopathy is not related to how bad the stage is. It's related to whether the macula is affected or not. Okay? يعني although stage 4 is more than stage 3 لكن stage 3 فيها loss of vision لأنه الماكيولا هي اتضربت في حين في stage 4 بيكون it's extensive لكن شنو لسه ما حصل لنا مع الماكيولا لسه ما حصل لها damage. اوكي. proliferative بيكون في growth of new vessels. So this is the hallmark of proliferative disease إنه في growth of new vessels on the disc أو everywhere else regardless يا هنا ولا هنا. تمام. هنا ده لسه الفيجن بتكون normal but sight is threatened. So if it gets any worse ممكن الزول يحصل له loss of vision. تمام. So بيكون في growth of new vessels. آخر حاجة في الادفانسد والادفانسد بيحصل when there's bleeding in the vitreous أو between the retina والvitreous. وبيكون acute loss of vision. So vision بيحصل sudden شديد. يعني عندنا two options لأنه يحصل loss of vision in cases of diabetic retinopathy. يا يكون في maculopathy so we've affected the macula by exudates وhemorrhages وحاجات زي دي وإديمة وإسكيميا وكده أو يكون حصل vitreous hemorrhage which happens eventually as a result of the proliferation ده. تمام. المانجمنت عندنا two options. عندنا good diabetic control عندنا retinal photocoagulation. الphotocoagulation ده بنعمله to reduce the progression of a diabetic retinopathy. Any questions يا شباب? Because I know this one is a confusing one. It's always been confusing for me غايته. So perfilation بتشوفوا the new vessels دي. And this is very common questions كتير شديد بتيجي منه. So دي ال vessels بتكون. Okay. طيب let's keep going then. دي كده diabetic and diabetic as I said is super important for you guys to know it in details. إنه في exudate, hemorrhages, dot and blot, cotton wool appearance, vision sorry growth of new vessels وفي النهاية vitreous hemorrhage. Okay. عندنا تاني hypertensive retinopathy. It's so simple. بيكون في atherosclerosis so بيكون في vein occlusion and that decreases the central acuity so central vision بيحصل له شوية loss. بيكون في retinal edema, optic disc swelling وexudate. تمام. لكن الدوت and blot hemorrhages والnew vessel growth والحاجات التانية دي كلها cotton wool appearance والحاجات دي كلها بتيجي مع منو؟ بتيجي مع diabetic. اوكي. A thyroid disease هم you know them lid retraction, lid lagging, ptosis الحاجات دي كده. عندنا tumors عندنا retinoblastoma mainly. Retinoblastoma is the most common primary ocular malignancy of childhood, so children. it's hereditary so and sporadic ممكن يكون random ممكن يكون genetic والgenetic يا يحصل deletion of chromosome 13 or this part of the 14 on chromosome 13 أو يكون في ال RB gene lost. So ال RB gene is a tumor suppressor gene. لو هي lost from both parents الشافع هيكون عنده retinoblastoma. تمام؟ الsymptoms it ranges. So some people have really developed يعني قدام وصلت without diagnosis and management هيكون الsymptoms حقتها super different from someone who's just had it. تمام؟ الحاجة اللي بشوفها أول حاجة leukocoria. Leukocoria is that بيحصل white pupillary reflex. You know how in your eye, even when you take a camera or you put flash through the eye or something, you're gonna see a red reflex. يلا if you have retinoblastoma, a reflex ما بيكون red, بيكون white. زي ما شايفين هنا. This is very abnormal. This is a very early case of retinoblastoma. بعد ذاك it gets worse. It can result in proptosis, which is basically a fungating mass. بيكون في mass protruding زي ده. ممكن يكون squint أو strabismus squint. ممكن يكون في vision loss. ممكن يكون في glaucoma in some cases, so increasing the pressure of the eye. ممكن يكون في retinal detachment. الحاجات دي كلها ممكن تحصل. لكن the one thing I want you guys to remember, like super early presentation of retinoblastoma, is إنه بيكون في white pupillary reflex. So in other words, if a person has red pupillary reflex, they don't have retinoblastoma. Make sense? طيب هنا next topic اللي هي glaucoma. الجلوكوما definition is increased intraocular pressure. You have to have the normal ocular pressure memorized اللي هم 10 to 21 millimeter mercury. تمام? If it goes anything above that, that's glaucoma. تمام? Intraocular pressure in the eye is basically maintained by the aqueous humor اللي هو الفلويد اللي قاعد في anterior chamber ده. تمام؟ أو anterior segment of the eye. Anterior segment يعني aqueous humor ده it gets formed and absorbed to keep the pressure حق eye stable. It's produced by the ciliary epithelium it's drained by the trabecular meshwork. تمام؟ وفي 4% drained across the sclera to the venous system لكن not that important. The main two guides in the trabecular meshwork اللي هم they absorb through the Schlemm canal وعندنا ciliary bodies they form it. So these are the two people who are super important. It gets formed, it goes and collects here, eventually it gets drained. عشان يكون stable and normal لازم يكون الform a rate حق production والrate حق drainage the exact same. صح؟ If one of them increases هتبقى مشكلة. Okay? Glaucoma causes loss of vision gradually. It's one of the biggest causes of irreversible vision loss. ممكن يكون في mechanical damage للnerves, ischemia of the nerves, وبرضه يكون في axon loss, which causes the peripheral vision, loss of vision. So loss of vision حق الجلوكوما ممكن يكون visual field issues أو peripheral vision issues لأنه بيحصل شنو؟ الأكسونز هي اللي بتبدأ تموت. So the longer the nerve, so the nerve is reaching the peripheral parts هي النيرفز اللي هتموت أول. So بنحصل narrowing of the visual field مع الزمن. فهمتوني؟ يعني visual field بيكون في الأول الزول بيكون شايف كويس and it keeps narrowing down لحد ما يبقى الزول ما بيشوف غير قدامه. That's how glaucoma loss of vision happens. Okay? Any questions? لو في سؤال اكتبه في الشات. Okay? عندنا classification. The classification of glaucoma is classified into open أو closed based on لو trabecular meshwork مقفولة ولا فاتحة. Okay? وبعد ذاك عندنا برضه ممكن يحصل له classification into primary, secondary و congenital based on the cause أو chronic و acute. تمام؟ في chronic أو primary open angle glaucoma. So open مهمة هنا معناتها شنو؟ معناتها trabecular meshwork فاتح. Okay? chronic so that it means that it happens over a duration of time, and primary meaning that there was no main cause causing it. تمام؟ الحاجة دي بتيجي symptomless in early stages الليت ستيج بتظهر بفيجوال ديفكت، والحالة اللي بتحصل إنه بيحصل pathologically cupped disc on fundoscopy. Let's show picture. أيوه. So basically the disc is very circular. In a very, it looks very circular. You just have to memorize إنه it's cupping. Disc cupping دي بتيجي معاها. Okay. طيب. التريتمنت ممكن يحصل increase medical to increase the outflow of the fluid. صح؟ احنا قلنا إنه المشكلة إنه الفلويد إننا ما في balance، إنه we're producing some fluid we're getting rid of some fluid. والمشكلة بتبقى إنه there has to be a balance. لو هو مقفول ما مقفول sorry it's open and there's still a lot of fluid being accumulated، معناته بس إحنا عايزين نزيد في amount that gets absorbed. So we can give prostaglandin analogs أو pilocarpine and these increase the absorption. تمام؟ أو ممكن نعمل decreasing السكريشن by beta blockers أو carbonic anhydrase inhibitors like acetazolamide. ممكن برضو نحاول to make the trabecular mesh bigger and to increase the amount of fluid اللي بينزل by حاجة اسمها trabeculoplasty أو trabeculectomy. لكن mainly ال open angle glaucoma أو ال primary open angle glaucoma بيستعمل ال medical treatment so pilocarpine و beta blockers acetazolamide. تمام؟ في واحدة تانية اسمها normal tension glaucoma not that common to be asked about. It's usually asymptomatic وبيكون في cupping of disc برضو في ال fundoscopy. If it's the visual effect is being like there's a lot of visual loss برضو medical management وبكون في splinter hemorrhages on the optic disc. Let's focus on that one and let's focus on the primary angle closure. The primary angle closure glaucoma, meaning that primary, so there was not a second cause, it was happened براو. Angle closure, which means that it closed. So في حاجة قفلت الtrabecular mesh. Okay? تحصل at the age of 40, more common in females. اللي بيحصل our risk factor is pupil mid position. And I'll have to explain that in a second. Let's see if there's a picture to explain that. There isn't, but okay. ما مشكلة. Basically, الpupil بتكفل الانgle. So there's a risk factor for that. It's more common in hypermetropia. لأنهم هم عندهم shallow anterior chambers. So because of that, it's easy to close. تمام؟ So اللي بيحصل شنو قلنا إنه obstruction of the angle by the lens. اللens بتكفل الانgle. And the second that happens, the eye starts to, the fluid starts to collect and the pressure بيبدأ to increase. This is a very sudden type of thing. It happens so suddenly. تمام؟ بيجي للزول photophobia, severe eye pain, eye watering و loss of vision. تمام؟ هذه فجأة بين يوم يعني ممكن تقول لك أنا صحيت من الصباح كانت حصلت لي حاجة دي. It's associated with headache, nausea, vomiting لأنه بيحصل increasing في البريشر حق الآي شديد. البيوبل بتكون mid dilated so ما بتكون fully dilated ولا بتكون fully constricted وبتكون oval and fixed. It does not move. البيوبل does not move. و eye is red لأنه ال acute angle أو ال acute angle closure glaucoma أو ال primary angle closure glaucoma is a cause of red eye. so حيكون ال eye red. وآخر شيء الdiagnosis بيستعمل حاجة اسمها tonometry to measure the intraocular pressure. هنلقى إنه it's very high. This is pretty much you need to act very fast. أول حاجة بنحط البيشنت in supine position to displace the lens back لأنه اللينس بتكون هي اللي قفلت الآي. تمام؟ تاني بندي زول acetazolamide IV. So this time it's IV because it's something urgent. وبرضه topical pilocarpine. طيب الsurgical management هنا ممكن نعمل laser eye reductomy. So we're getting rid of the lens. Sorry مش lens iris. Surgical eye reductomy أو lens extraction. So we just do surgical treatment في الحالة دي to fix الحاجة اللي قفلت الcanal or trabecular meshwork. This is an emergency, again, as I said, so treatment has to be very fast because لو حصل loss of vision, it's not reversible. تمام? It's glaucoma. What happens is that the pressure kills the nerves, and nerve damage is not reversible. So you have to act very fast. It's probably the most common one of the types of glaucoma بتيجي في الامتحان, so it's super important you know it very well. So primary angle closure أو acute angle closure glaucoma. تمام. Is this one very clear يا شباب? No, it's very common. It's like super important you guys go through it. في congenital glaucoma, it happens at birth or within the first year. Not that important. المهم إنه إحنا في الحالة دي بنعمل incision للtrabecular meshwork أو trabeculectomy اللي هي إنه بيعمل passage between the anterior chamber and the Schlemm canal. It's just surgical management. في secondary glaucoma اللي هو برضه due to trabecular obstruction، لكن trabecular obstruction happens due to another disease. So there are a lot of diseases that can cause a secondary glaucoma ده أو secondary closure glaucoma, angle closure glaucoma. A lot of the causes here are written. You just gotta go through them quickly to just be familiar with it. Don't worry about it too much. تمام؟ دي congenital glaucoma. This is tonometry, which basically measuring pressure of the eye. These are splinter hemorrhages. Don't think it's that obvious. With the disc cupping. لو هو secondary glaucoma, you just treat the underlying cause. طيب. Next عندنا cataracts. Super important as well. One of the biggest and most important causes أو disease أو causes of blindness. طيب. الفكرة هي شنو؟ إنه إحنا عندنا a lens is no longer clear. A lens بتبقى opaque. So it leads to visual loss. And it's the commonest cause of treatable blindness worldwide. So cataracts is the most common cause of blindness, لكن treatable blindness. And that's a good thing about it, is that it can be treated completely. تمام؟ في a lot of conditions that cause it. Just go through them really quickly to be able to remember risk factors. لكن what I want you to remember is diabetes, metabolic disorders, steroids, and trauma و other vision issues. يعني مثلا إذا كان عنده أصلا myopia بيستعمل steroids الحاجات دي. risk factors التانية cigarette smoking, corticosteroids, obesity and old age. عشان كده usually بتيجي في الناس العجايز. تمام؟ اللي بيحصل is painless loss of vision وفي meiosis, so constriction of the pupil. وفي حاجة اسمها glare. الglare ده basically إنه بيحصل scattering of the light. so لما تعاين للزول بيكون في glare، العين بتكون or like when you take a picture or something or you put light through the eye you feel like the light is scattering. تمام؟ reduced visual accuracy وبرضه بيحصل loss of the red reflex. so اللي شايفين هنا ال red reflex بقى ما فيه. This is a normal red reflex. This is in cases of cataract. راح يكون ال red reflex ما ظاهر. تمام؟ طيب الانفستيجيشنز بنعمل visual acuity بنلقى decreased. سامعين يا شباب؟ بيحصل pupillary response. في a bunch of like calculations you can do and stuff لكن don't take it too much into consideration. بنعمل slit lamp we just basically look at the area هنشوف إنه في opacity في اللينس بس lens is opaque, the lens is no longer clear. طيب في indications for surgery يا يكون في medical indication أو نكون عشان to improve the vision. في a few types of surgeries that we can do. عندنا extracapsular cataract extraction, so we take the lens from outside. Intracapsular وفي حاجة اسمها phacoemulsification, which basically means that إحنا بنعمل it's laser basically. You use laser to break down the lens and you take it out. And the good thing about phacoemulsification is that it does not need suturing and it's a very small incision and it's a very safe procedure. تمام؟ اللي بيحصل شنو إحنا what we just did is that we basically broke down the lens and took it out. لأنه lens كانت بقت white. So now the person does not have a lens anymore. What we have to do is one of two things. What we have to do is give them a lens. تمام؟ لو بقت ما في lens أو the thing that happens right after the cataract surgery is إنه يبقى ما في lens. يبقى زول عنده aphakia. And what we do is that we give them a fake lens. يسمى pseudophakia. So in other words إحنا بنشيل اللينس برا وبنديهم a fake lens. So the treatment is مثلا phacoemulsification أو extracapular cataract extraction أو intracapular cataract extraction with lens, with a fake lens, with an artificial lens. Is that clear يا شباب? Any questions? That's it for the session, by the way. لو في زول عنده سؤال اتفضل. There's 3 minutes left on the Zoom. طبعا يا شباب just make sure you go mainly through ناس الجلوكوما والكاتاراكت الدايابيتيك retinopathy دي المهمين شديد glaucoma cataract diabetic retinopathy and the causes of a red eye like make sure you go through them very quickly just to be able to tell which is which and like the causes and so on لأنه these are usually like أكتر حالات confusion I think إحنا في our exam there was an extra topic like جاتنا questions about the types of tests you can do but I'm sorry I don't have any information about it طيب يا شباب if there's good luck you guys with your exam hopefully يعني you guys do great إن شاء الله don't get discouraged مع medicine surgery is hopefully gonna be better and yeah
Thank you, Yamara.
you're welcome guys I wish I could have done it
Thank